Broadly speaking, precipitated withdrawal can happen when taking Suboxone too early or too soon, immediately after using another opioid like heroin, oxycodone, or fentanyl. But typically, in current times, we talk about precipitated withdrawal most often when people are trying to get off of fentanyl and onto Suboxone. So I'd imagine most people who ask about precipitated withdrawal are actually trying to get off of fentanyl, right? And they're worried about precipitating. So the first thing is that it's a partial opioid receptor activator, not a full opioid receptor activator. So I liken it to being lighter weight. It's not as heavy. It doesn't press down on the button. If you imagine the opioid receptor as a button that needs to be pressed down to be activated, it doesn't press down as hard, so it doesn't activate it as hard. That's why it's actually a very safe medication. It's very hard to overdose on buprenorphine. Okay. The second thing to know is that buprenorphine's very sticky. It has high binding affinity to the opioid receptor. So it means it's going to stick preferentially to the opioid receptor over any other opioid, including fentanyl, heroin, oxycodone. So when you think about all that, when you take Suboxone or buprenorphine too early, immediately after someone doses with heroin or with fentanyl or oxycodone, what happens is that heroin molecule that's sitting on the opioid receptor is going to get knocked off. It's going to be pushed off because that buprenorphine's stickier. It's going to want to stick and adhere to that opioid receptor. And when it sits there, remember, it doesn't weigh as much. It's a lighter weight. It doesn't activate it as much. All the millions and billions of opioid receptors in your system actually get a decrease in activation. So what happens when there's a decrease in activation? Opioid withdrawal symptoms. You get sick. How to stop it? You need to undo the drop in activation, meaning some people will use their opioid of choice to reactivate all their opioid receptors, or they need a significantly large quantity of Suboxone or buprenorphine to really activate all those opioid receptors and press down. Precipitated withdrawal is different from regular opioid withdrawal, right? It's abrupt. I liken it to slamming on the brakes of a car. When you stop taking heroin and you just simply withdraw and let the heroin leave your system, you do get sick, you do get withdrawal, but it's not precipitated. It's just because buprenorphine is such a sticky molecule. It's going to knock off everything off of those opioid receptors. Whatever feels safest, right? The patient doesn't have to contact us. If they're feeling terrible, go to the ER by all means. Okay. If they're feeling like they're about to go into precipitated withdrawal, or they're able to kind of handle the distress, the unpleasantness of withdrawal, then please reach out, right? And the on-call provider or their own provider can work with them, offer maybe some comfort meds or offer guidance on how to dose their Suboxone to get out of precipitated withdrawal. In terms of avoiding precipitated withdrawal versus stopping precipitated withdrawal, the evidence is actually not that strong. It's still, the research is still happening. The literature is still growing. And these studies are happening right now. But because of that, there's no standard of care on how to avoid precipitated withdrawal.